Good evening and welcome to tonight's oncology webinar. Thank you to everyone for joining us this evening. I am Lydia Morgan, Commercial Manager here at VVS. I'll be introducing our speaker for this evening, Dr Clare Knottenbelt, with her thought-provoking webinar on cancer conversations and breaking the news. We really hope you enjoyed tonight's webinar, and by the end of the session, you understand that you don't need to manage these oncology cases alone. VVS have a team of friendly and knowledgeable veterinary specialists who can support you with advice calls, oncology protocols, written reports, radiology requests, or with our Halo service, our live guided specialist consultations. These include specialist live guided cardiology workups, live guided abdominal ultrasound, and our live guided chemotherapy support. If, like me, you find both obtaining and interpreting cardiac images a little tricky, or if you want real-time support as you administer that first dose of chemotherapy, you might appreciate a VVS specialist guiding you through. Well, I have good news for you. With VVS, you can have just that. Our experienced specialists, such as the lovely Claire, who is speaking this evening, can lead you through these cases in real time. Feel empowered and supported as they guide you through the process of a complete specialist workup and help you to establish a suitable treatment and management plan for your patient. This service can be possible in your practice through the installation of a VVS workstation with our sophisticated video sharing and diagnostic platform. If this is of interest, please do email us at info@vvs.vet or visit our website www.vvs.vet and we will be happy to tell you more. Do also remember our advice calls and written reports can be accessed by any veterinary team from anywhere. There's no need to register or subscribe and no equipment needed to access these services. VVS is truly an extension of your practice team. It's now my absolute pleasure to introduce Dr. Clare Knottenbelt, our CVS specialist in small animal medicine and VVS oncologist. Claire graduated from the University of Bristol and worked for a year in mixed practice before starting her specialist training in small animal medicine at the University of Edinburgh Veterinary School. She obtained the RCVS diploma in small animal medicine, as well as a master's in transfusion medicine. Claire worked within the University of Glasgow's oncology service for 11 years and was the clinical director of the small animal hospital for 6 years. We're therefore very lucky to have Claire presenting this topic for us this evening, sharing with us her vast experience and important understanding of the emotional impact a cancer diagnosis can have on pet owners. If you have any questions as we go through, please add them to the chat box and we'll finish up the presentation with a question and answer session at the end. So without further ado, I'll hand over to Claire. Thank you, Claire.
Great. I'm just going to stop my video so you can all see me. Welcome to everybody, and thank you, Lydia, for such a welcome today. And as Lydia said, today we're going to be talking about cancer conversations and breaking that news. And obviously, as an oncologist, that is something I spend an awful lot of time doing, both in terms of initial breaking the news and also subsequently breaking the news of what can and can't be done with my patients. And that's something I've been doing for many years, and it's something that I've really grown to enjoy. And I think people always think when you become an oncologist, life is rather miserable because all your patients are going to die. When I have to say, when I was in medicine, I found it more depressing because I always expected my patients to live, and certainly not all of them, and many didn't survive. So being an oncologist has its challenges, but it's extremely rewarding, and I really enjoy supporting all of you guys to be better oncologists out there in the real world. So what are we going to cover today? Well, exactly what is bad news? For the client, what are the different areas of problems that we might encounter when we're breaking the news? How should we present it to the best of our abilities? And importantly, how and why will this affect us as clinicians? And that's a really important part of understanding how we break the bad news. And what can we say or do to maybe make it hurt the clients a little bit less and maybe make it hurt us a little bit less? Certainly, speaking to vet students, they're often very anxious about this part of the workload. And so I hope by the end of today, you'll feel a little bit more confident in doing it and how to do it to the best of your capacities, and also understand the impact it has on you and how to protect yourself from that as well. So first up, what is the bad news that's associated with cancer? And when we think of breaking bad news in any format, it's important to understand what it is. And it's defined as any information that changes a person's view of the future in a negative way. And that's not just about the patients that you can see on the right here. This is a dog with end-stage splenic hemangiosarcoma. Yes, this is bad news. We can see that from the animal is really, really sick. We aren't going to come back from this. But there are a whole range of other bad news. It's not just that end of life moment that we need to consider. It could be that we've got a new diagnosis, so we've diagnosed cancer for the first time. It could be that that cancer or another illness has worsened. And remember that many of the patients that we treat with cancer are older, and so they have concurrent disease as well. And interestingly, the spaniel below there is a wee dog called Ollie, who I've been looking after. He was a cancer patient. I've been looking after him now for nearly 9 years. And he's now got really severe hip dysplasia and a hip luxation. So his illness at the moment, his major problem is actually not cancer related. It's the fact that he's not very mobile on his back end anymore. And to be honest, we never thought we'd get to this point anyway. So we're pretty impressed to be here. But his illness has worsened in terms of concurrent disease. We also need to remember that every time current management is not effective and we need new treatment, that is in effect a bad news situation for the cancer patient. So we might not be saying there's nothing more we can do. We might be saying, okay, we need to move on to something else, but that can be perceived as bad news because it changes our perception of the future in a negative way. And of course, for our patients, we have to remember the financial bad news as well. And this is a really big one. With rising costs that we know we have to charge, it's not a question of the costs are wrong. It's just that for some people, they can't afford that. And that financial bad news can come really at any point on the cancer journey. So it might be at the very beginning when we're saying, okay, we need to do a fairly major surgical procedure, follow this up with chemotherapy or radiation therapy. But it might be that actually these patients have gone on far longer than we expected. And we're now at the point where we haven't got any more insurance money left, or we haven't got any more budget left to spend. And we're now thinking, oh, we're going to have to use a different drug. So for example, when we use L-asparaginase in lymphoma, we used to use it pretty regularly, and the price now is really exorbitant. So it's around about maybe £1,000 to even £1,500 to the client per dose. So, and I tend to use it now more as an end stage situation, but that's a big financial hit when you've already done a huge chemotherapy protocol. To them, for me to be saying, okay, I can give you this drug, it's a single dose, is £1,500. That is a huge hit of financial bad news. So we need to just remember that whilst end of life news is one aspect of bad news, we have actually all these steps along the way before we get to end of life news. So how do we minimize the hurt specifically really to the client and try and keep them on our side? Well, we need to be able to move them from the bad news scenario to future plans with realism and some degree of hopefulness. And you think, well, come on, Claire, you're an oncologist. What hope can you actually genuinely give to the majority of these patients? And yes, it depends what we define as hopefulness, okay? Hopefulness is that idea that there's a hope that we can do something. That something may eventually be euthanasia in a really gentle and nice, supportive way, okay? Or it might be that there's hope because we can treat them with some surgery or we can treat them with chemotherapy. So it's important as vets that we have a mental strategy for taking the clients on this journey so that we can give them a realistic outcome, not give them false hope, but to give them something that's realistic, but we are taking them forward with a clear strategy. So we have to provide ourselves with a mental strategy of how we're going to provide the information to them, how we're going to deal with the emotions that come up from the client, okay, and have a clear plan for further care or support. And that might be, that further care might really be very palliative. It might be very significant management that we say, okay, we're going to do this chemotherapy protocol, or we're going to give options for this treatment or that treatment. Or, as I say, it could just be end of life palliative care that we're talking about, with a view to euthanasia in the shorter term. And the really important part here is the core of all of this is the relationship that you have with the owner and their pet. And this is something that you do develop. You know, you'll have clients who want to see you as particular individuals because they feel that you understand their pet. And some of the best practitioners that I've ever worked with have actually been ones where owners say to me, oh no, I always see Alistair. He loves my dog. He thinks she's the best dog ever. She's always so well behaved. He just thinks she's wonderful. So that relationship is really important, and it matters far more than necessarily your ability. What matters is they trust you and they believe that you have the best interest of your pet at heart. And I've got a picture here of Drac, who was a dog that I treated for lymphoma many years ago when I was at Glasgow. And he's a very interesting case because every week Drac would come in and he would have his chemotherapy. He was on a CHOP protocol, so we were seeing him very regularly. He got to the end of his protocol and he wasn't coming to see me so much. And the funny thing is that around that time we were opening the small animal hospital, and the Scottish news programme came and did a piece at the hospital and interviewed me. And so I was on the news that night, and Drac apparently ran over to the telly when I came on and was looking for me behind the television to see where I was. And the owner presented this as being a sign that Drac loved me and was very, very looking for me, was missing the fact that he wasn't seeing me as frequently. I did say to the owners, are you sure he wasn't petrified that I'd now arrived in his lounge? But the reality was this owner was absolutely convinced that Drac thought I was great, okay, even though I was the one giving him his chemo every week and then every couple of weeks. And the key thing we're here as well was that when Drac passed away, the owners got a new puppy. And even though I was at a referral hospital, they brought their new puppy in to see me. So, you know, we really had a relationship, or they perceived that we had a very close relationship. Obviously, he was one of many patients that I was dealing with, but it was about presenting that in that way to understand that I really cared about Drac and they felt supported and cared for all the way through. So if we need to remember that that's an important part of it, is that sharing of that relationship. Now, using a template to break bad news can help ensure that you're doing things right, but it's also really important that you don't get too tied up to a template. But what we want to really achieve is a sort of structured listening to what the patient knows. And in this case, obviously, we're going to be talking about clients, okay? So this is the templates they use in the human world. So what does the client know? And what do they actually want to know? So some people don't want to really know. I remember I had a client who had the dog had a really nasty squamous cell carcinoma of her vulva, and it was eroding away the whole vulva, and it was absolutely horrific down there. The client did not want to know what that looked like. They really did not want to know. They didn't want to hear it. Now, that can sometimes be difficult when you're trying to explain that there's not much more we can do and that the dog is suffering. But some patients and some clients don't want to know the detail. So just bear that in mind, that not everybody wants to hear the minute detail about what's going on. I'm lucky because in a referral situation, the majority of people do want to know the nitty-gritty detail. You need to give information in understandable amounts and make sure that you're checking that they understand it, but also give them time to react to the news. And this is something where when I was teaching, it was a lesson I learned, was when you ask a group of students a question in a lecture, you can't expect an immediate answer. Okay, so we were taught to maybe wait for 10 seconds. And I can tell you, when you're standing up in front of a lecture hall of 100 students and you're having to wait in silence for 10 seconds, it is agony. It feels like such a long time that you're waiting and nobody knows the answer to the question. And then eventually someone will put a hand up and say something, and you're like, thank goodness. But actually, for the people listening to that talk, that 10 seconds didn't feel that long because they're thinking. And it's the same with clients. So you need that balance of not kind of butting in with the next thing. Give them time to process, give them time to understand what you have just said, and check that they understand what you've just said. So generally, in the human world, they use a template called the spikes template. And I think this fits quite nicely as well with what I do. I didn't ever start with a template. I just evolved the way I break difficult news to clients over many years of having to do it and working out what works and what doesn't work. So, but I think actually when you go through this, it fits quite well with the way I've learned to do it. So first of all, we need the right setting, and we also need some good preparation as part of that. So the setting matters. We want to be able to take the clients into a private place. We don't want to be doing it in the car park or in the waiting room and starting to talk to them. We also need to make sure that we're not going to be interrupted. So we're not, expecting the nurse to pop in and check on, something that's in recovery, anything like that. We want a little bit of privacy, and we want some time set aside to be able to talk to the owners. I think one of the things that I've learned as well, I know for many of you, you're out in practice and your time is really precious, and so you don't want to waste time. But what I've learned both through my veterinary work and through some of my coaching work is actually the more you relax and just not worry about the time, the faster things happen. It's a bit like, trying to get a dog into the car that doesn't want to get into the car. The more stressed and the more you kind of rush it, the harder it becomes. So just take your time, and you'll actually find it goes quicker when you relax and step back and just take the time to let the owners have that time and space. We need to be clear on the perception of the situation, so the owner's perception of the background. Okay, we need to have an invitation, which is like, I'm going to, explain this. Is that okay? And then we're going to look at knowledge. What does the client already know about the situation? We're going to try and deal with their emotions with some empathy and show compassion and consideration for them, and then work out a strategy for the future. So we need to kind of explain the situation and then work forward from that. Now, when I'm dealing with a referral type consultation, even though I know what I'm dealing with, and I already, if I do a consult, I know what options there are for this client, I know what the survival times are, I know all of that stuff, I don't launch straight into that at the start. I spend quite a bit of time talking to the client, just to very gently build up the kind of rapport between us. And so whilst I can read your histories and I know everything I probably need to know from the histories, talking to the client and getting the information from them is actually about that relationship building, and also me understanding what they know about their own pet. So it's building up those bricks and understanding what is their perception, what do they want, what do they want for their pet, and then at that point I can come in with the facts and the knowledge, okay, and then we can try and work on the strategy for the future. But it's really important to do that. And I think that's something I would say, if you are dealing with a difficult situation where you're not the vet who they've been dealing with and you're having to be the one that delivers bad news, which happens, it's not a perfect situation to be in by any means for any of us. But if you are in that situation, then it is really worth just taking a little step back and just saying, look, I've read the notes, but could you tell me a little bit about what's been going on from your perspective? Because that helps build the relationship before you kind of drop the bombshell, which is much better. So how can we help you? Well, you'd notice on the last slide, there were a couple of little asterisks part of the spikes protocol. In VVS, the main thing that we can do is we can provide you with the knowledge about the condition, what are going to be the options, what's the likely outcomes from this patient, and provide information on the strategy for the future. And going into these consultations with this information, with the knowledge that backs up the diagnosis and understanding the outcome, and also the strategies for the future. Now, it's important to understand that just because a client has said they don't want something, like they don't want chemotherapy or they don't want to consider major surgery, it's really important to understand that that doesn't mean you shouldn't talk about it. And I think that's the sort of common misnomer, that where the client discards one whole category of treatment immediately. I don't want my dog to go through big surgery. I don't want them to go through chemotherapy. Okay. And so you then focus on what are the other options. I always take the time to talk through those options, because actually them just getting that reassurance that is definitely not what they want, it means that in the future they're not going to have that huge amount of guilt. It means you can support them and balance them when they're feeling guilty that they didn't do big surgery. You can talk to them about, right, well, this would involve, you know, taking away a whole leg or radical surgery, okay, or significant chemotherapy protocols. And I put a few cases up here that are cases that I've dealt with over the years, to just remind you of all the different ways that an oncology patient can be managed, if you like. So on the top left there, we have a dog that was, he actually had mast cell tumor and he was getting a vinblastine protocol. And then subsequently, so that was, you know, bad enough news, but he did really well and he went on for a long time. And then he came back to see me because he developed a really erosive, nasty squamous cell carcinoma on his nose that was just eroding his nose away. So that was a dog where I had a close relationship with it. And then a number of years later, we had to talk again about more bad news. The gorgeous little corgi with the floral wreath around her, she's a little dog that went through CHOP protocol, and I got this fantastic wee card back from the owners with these pictures in, because they really wanted her to still be around for the daughter's wedding, and this is her being a flower girl at the daughter's wedding. So they were really delighted with everything that had come from that. And the interesting thing was, they came initially saying, I don't want to do chemotherapy, but we talked through all the options that were available for her. The one on the bottom is a dog with osteosarcoma that went on to have carboplatin chemotherapy. And the addition of carboplatin chemotherapy into osteosarcomas can make a significant difference to survival times. And the drug is really, really well tolerated. And then lastly, on the bottom right there, that's a splenic hemangiosarcoma coming out. Unfortunately, today I had to break bad news to a client of a dog that's got metastatic hemangiosarcoma. It's now 6 months after the spleen was removed, and we just re-imaged it today, and it's the liver's riddled. So, you know, that was a situation where we had bad news 6 months ago. We've been monitoring, we've been doing treatments, and now we've got more bad news to deliver, unfortunately. So, you know, sometimes it comes in cycles, and you may have more than one opportunity to present and talk about the bad news. It's really important as well to understand that there will be an impact on you. You know, if you have one of those days where everything is a PTS, or everything is just something that can't be fixed, it can be extremely stressful. Okay. And I think we get better at it with time, but some of us get better at it because we close our emotions down. And it's really important that we understand that that's not a very healthy way to go forward. You need to experience these strong emotions, and that's natural. Okay, so it is perfectly reasonable to be upset. And that is in part because we have this anxiety about the burden of responsibility, that it's our job to make things better for every single patient and every single owner. Okay, so we feel like we maybe fail if we haven't, you know, we haven't managed to fix them, or we've got to this point. Maybe there's been a long investigation to get to the point that now it's a cancer diagnosis, and that's not something that you'd considered at any point in the future. We also fear a negative response from owners, and I've had all sorts of owners. I've had owners who've cried and shrieked, and owners who've gone silent on me. I've even had an old man who literally collapsed in front of me, and we had to get the first aiders in to help him. So all of these things can make you very reluctant to break bad news. It means that you might avoid discussing poor prognosis and give unwarranted optimism. And I see this sometimes where people have gone, oh yeah, I'm sure, I'm sure there's something that someone can do, and they sort of kind of fob it on to either a colleague, say, oh, come back in, I'll do some antibiotics meantime, and then we'll get you back in next week, and then you maybe step back and get someone else to deal with it because you don't want to be the one that breaks the news, or you don't want to have to go back on your optimism when you said, oh yeah, it's all going to be great. But fighting this can predispose all of us to depression. So it's really important to be aware of this impact and to let those emotions out if they need to come out. And, there's been times with the dog in the previous picture, the one that developed the nasty erosive nose. I managed him for a long time, and his owners wanted me to be there when he was put to sleep, me to be the one to do it. And it was heart-wrenching because I'd looked after that dog for such a long time, and the owners were I was seeing it at one point every week, and I had a relationship with those owners. They were like friends to me, and it was, there's no doubt I shed a tear when he was put down, and I was, I felt a little bit unprofessional, and then I thought, no, this is okay because it shows that I genuinely care. It's not a failing, it's not a weakness to show your emotion. And if you are in that situation, you need to get out and release it and make sure that you stay healthy and happy. Because if you just keep bottling it up and closing that down, that's when you end up burnt out with things like compassion fatigue and so forth. We know that in human medicine, you're more likely as a clinician to feel an adverse effect, okay, if you are inexperienced. So we need to particularly watch our younger colleagues, the ones that have just graduated and have less experience in this area, because they're more likely to feel it. Where the patient is young and where there's limited options for treatment. And I remember a patient when I was working at the vet school. It was a 6-month-old boxer, and it was when I was working in the medicine team, and we just couldn't get to the bottom of what this dog was doing. We were convinced it had some sort of clotting problem, and this dog was in ICU, and it went on and on and on, and eventually the dog just wasn't getting better. And I said to the owners, look, we have to call it a day. I'm really sorry, there's nothing more I can do. And I was really gutted. But they did agree to a post-mortem, and the pathologist said, oh, you've got to come up and see this. And I'm like, I just can't come up and see it. I'm really connected to this this dog. I was relatively early in my career at this stage, and so I was, I suppose, less experienced than I am now, and there was limited options for treatment. So now I see this, I know why I was feeling that way, that I didn't want to go and see the post-mortem. But when I went up, they showed me that this dog was riddled head to toe with cancer. And that was incredibly sad, but it also meant that I was right. I was right to say it was time to stop. So trust the fact, if you really feel that there is nothing more you can do, then trust yourself. Don't feel that you're necessarily wrong, because often you are right, okay? And it's the right way and the right way of dealing with it. So remember that you may feel uncomfortable discussing prognosis and possible treatment options when the information is unfavorable. So if you know you're going to have to tell this poor owner that their 6-month-old boxer is riddled with cancer and there's nothing we can do, it's sometimes easier to shy away from that and just keep trying and just keep trying. And I suppose that's where I touched on at the start about in medicine, you get these patients and you really want them to get better, and they should get better, and then they don't get better. And I found that very difficult. Whereas I find with oncology, patients come to me and they already know it's going to be not a great outcome and probably a pretty bad outcome. And so everything that I can do is positive. And so don't shy away from this, because even supporting a patient palliatively can give you a positive outcome. So why is it so hard for us? We don't have to worry about our patients' expectations, okay, which is great. And that's one really big positive for us as vets, because in the human world, if you're talking about your own health, people have expectations or dreams for the future or fears. So that's a good thing. Our patients are generally oblivious, which is great. Okay, so we don't have to worry about them. But it's the owners whose emotions that we fear. Okay, their reactions. And owners can react in a whole range of ways. And I think I've seen pretty much everything over 30 years in practice. We need to therefore consider their unreasonable hopes and expectations, okay? Because owners will latch on to their pet, and often the people who have unreasonable hopes and expectations, there's a reason behind it. Okay, so there might be a connection with a lost loved one. It might be the only person that they have in their life. We might find it scary discussing the financial aspects of the disease. Okay, it can be really hard to balance what's best for the patient with the cost. Okay, and this can be really difficult, I find, with owners, because owners don't like to feel that they can't do things because of cost. Okay, so if people give me a cost flag when I'm having that conversation, like I might say, okay, CHOP is going to cost around £6,000 to £8,000, and you can see on their faces that they look quite shocked, and I know that maybe their insurance limit is never going to cover that kind of money, and they're like, oh, and you can see they don't want to say it. Then I might say, but it's a very long protocol, so if we don't get that far, you pay as you go along. But there are other protocols we can look at as well. Some people prefer this one, which is a lot cheaper, and this is the difference between it. I tend not to focus too much on cost as the reason, even if I can see cost as the reason, because I think otherwise that is quite difficult for them. It's important to remember that fear that we aren't competent to provide treatment can really increase our anxiety to try and steer them away from a particular course of action. Okay, so if, for example, you're thinking, oh, but I don't know if I can do an infusion, a chemotherapy infusion, or I don't know if I can do that surgery adequately, and they can't afford referral, it becomes really difficult because you're sort of suggesting things that you don't feel confident about. But remember that we can support you with many of the things that you need to be able to do in practice to deliver that treatment. So reach out for help and get support. And if you need to refer on because it's really too complex, like a surgical situation, then that's okay. Okay, so don't feel stuck because you feel you can't provide the treatment. Sometimes we end up feeling embarrassed at having painted too optimistic a picture. And I had this just a couple of weeks ago. I really convinced myself that this cat had only maybe 2 lesions in its abdomen, and we could maybe remove some of its disease and maybe treat it with chemotherapy afterwards. The owner wasn't too keen on chemo, so surgery seemed like the best option. And then when we went in, it was looking a lot worse than we suspected from the imaging. And I must admit, I felt embarrassed because these owners were spending a lot of money, and I maybe painted too optimistic a picture that if we could remove those 2 bits, we might buy a reasonable amount of time. So it happens even when you've done 30 years of the same kind of job. You can still get into a position where you feel embarrassed and you think, oh, damn, I've painted too much of an optimistic picture. Don't keep digging in that situation. Just stop for a moment and say, okay, I did my best. I was trying my hardest at that point to do what was right for the patient, and that's the right approach. It just wasn't quite right for that patient in this situation. And then we can learn from that and go, okay, next time, maybe I'll go a little bit different. But don't get so far down the other side that you're then going, everything is terrible and it's a real disaster. And you're telling everybody that it's always going to be terrible. Okay, because then you're going to actually go the other way, which is not great. We can also have a fear of inadequacy in the face of uncontrollable disease. We always hope that there is something still else on the list to do, and sometimes there just isn't. And that can make us feel very inadequate. So it's important just to understand these impacts that it's going to have on us as individuals, because the impact that happens to us will be reflected in the way we deal with it when we're dealing with clients. So what should we say? How should we deal with things a little bit better? Well, first off, remember that many owners do want to have details about their pet's condition, but some don't. Okay, so don't impose information on people. check that they understand what you're talking about. And it's a funny one, because, you know, many of you will have done consultations with medical practitioners, you know, where someone puts doctor on their name and you're never sure if that means they're a medical doctor or a PhD doctor. And so it's always a bit awkward. Do you use the veterinary terminology and the medical terminology, or do you use the basic terminology? So what I tend to do with this is really start basic, even if I'm aware that I'm dealing with a medic, okay? Because actually they may not be a medic in the area that we're talking about. But if they start using words, so if they say, oh yes, well, my dog's got polydipsia, then I can use polydipsia once I've talked about her drinking a lot, rather than the drinking a lot. So what I do is I adapt my vocabulary as I go along, but I still use what I call basic, slightly patronizing conversation words to people who I know are medically qualified. And I tell them at the start, look, if I'm using terms that you find a bit patronizing, or, you know, then please just tell me. But I far rather make sure that I'm using non-technical words so that everyone understands what we're talking about. Okay, because people will dot in words that they've heard from doctors. So if they've had a friend or a family member or themselves gone through chemotherapy, they'll drop in words and kind of like to show that they're knowledgeable, but actually their knowledge may not be that great. So always assume that they don't know very much. Don't assume that they know it, and just because they're using difficult words themselves. We also need to avoid excessive bluntness, okay? And you can see in this beautiful reconstruction of a CT of a cat's chest, that was a case that I dealt with when I was locuming. And basically you can see there is just half the lung on one side has basically gone. There isn't anything there anymore. And, you know, when I saw this, I kind of suspected it because we'd already had some x-rays from the referring vet, and I kind of suspected it. But just going in and saying, you know what, your cat's, you know, in real trouble is not going to help the situation here. And what happens is, if you go in with that blunt approach, which is often the approach that people take when they're in a rush, it means that the owner can feel quite isolated and later will be very angry with you. Okay, so actually just taking your time and being very gentle and giving it in small chunks. So in a situation like this, I will not jump to the obvious thing on this CT, which is the fact that half the lung on one side is gone because it's full of tumor. Okay, I will talk about, right, this is the cat, it's lying this way, here's the airway. And what that's doing is it's checking the understanding. You can see the lung on this side is, you know, that's a pretty normal looking lung, but look, we can see that the lung down here is all gone. Okay, so we can then talk about what's happening and why that's happening. So give the information in small chunks and just stop periodically to make sure that they understand. Don't just launch into a great long diatribe. And then say, would you like me to explain that a little bit more if they're not understanding it? Or, you know, are you okay for me to carry on and explain the other part of this? When the prognosis is poor, as in we're really kind of getting towards the end and there isn't anything else we can do not say there is nothing more we can do for your pet. Okay, because there is always something more that we could do, but the something more might be euthanasia. Okay, and it's important. Interestingly, there was a survey just recently that was talked about in the Vet Times, where they looked at what owners were happy talking about with their vets. And one of the things owners did not want to talk about was euthanasia. They wanted to talk about quality of life, and they were very happy to talk about quality of life because that was their priority, but they were scared about talking about euthanasia. Okay, and we need to make sure that we can keep euthanasia in the conversation even when they don't want to talk about it. So the goals in care will change. So when there's nothing more we can do, you know, the lymphoma that's relapsed again and we've run out of options, got another one of those currently running through at the moment. We're on like the last ditch attempt. There is always something that we can do, even if it's only pain control, symptomatic relief, or planning the euthanasia. And for me, I take every opportunity to talk about euthanasia. okay, which might make me a bit of a negative bunny, you might say. But if when my clients ask me, how long will Fluffy have, that's my opportunity to talk about euthanasia. So I can say, well, it's really difficult to say, but maybe 3-4 months, maybe 3 days, maybe 3 weeks, depends on the situation. But what I'll do to them is say, have you ever lost an animal before? Have you lost a pet? Have you been through euthanasia with another pet before? And that starts the conversation, okay? Because what strikes me, and I've spoken to many people, and pretty much every client I speak to these days, I talk about euthanasia in some context. Many owners don't understand what's involved. Okay, we assume that they understand that it's a gentle death and it's a kind death, but they do not understand what's involved for many of them. Many of them, their only experience of euthanasia has been a family pet being taken away to the vets by someone else, and then it's gone. They don't understand the process. They don't understand the system. And I often liken the planning of euthanasia to this mountainside. So when you look at this mountainside, you can see we're at the top of the crag. We've got sharp ways down, which would be a sudden dramatic fall. We've got slow slopes down. We've got sharp, then slow. So there's lots of different ways of coming down this mountain. And I always talk to the owners about this kind of mountain of disease progression. So we might be likely to go steep drop and then plateau, or it might be plateau, 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 drop, plateau, 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 drop. And I can't predict that. They are going to have to monitor every day. And we're going to understand that we don't know. We know where we're at, and we know we're going to get to the bottom, but we don't know how long that journey is going to be and what it's going to look like. So in my experience, do discuss euthanasia in detail. That means we're going to put a catheter in, we're going to give an overdose of anesthetic. And I find having those conversations before we're at the euthanasia point is really helpful. And I tend to get owners to go away and plan what they want for the end day. Do they want them to be able to eat normally, go out for a little walk? What do they want for the end point of care? And this makes life a lot easier because we're bringing up that conversation of euthanasia early on before it's really a big issue. They can think about ashes back, caskets, whatever. They can have all of that kind of planned and thought about so that when that crisis moment happens, it's not so much of a crisis. But explain it in details and use those ins where they say, what will the end be like? Okay. What will happen when, Fluffy deteriorates with this particular tumor or this particular location of disease or this particular combination of diseases? So, for Oliver, we were just having that conversation today that the chances are he's going to go off his back legs, and it's not going to be his previous cancer problem that's going to be the end for him. So we talk about why that might be the end. So what else do we need to do? We need to make sure that we can identify and acknowledge the owner's emotions. Okay. If they are silent, use open questions. Okay. So a little bit of silence, let them process. Don't just leave them sitting in silence without saying anything, but give them a moment to think about it and to let them process. You can ask them how they're feeling or thinking, but it's really important not to say, I know how you feel. Okay. Even when we've been through it ourselves with our own pets, we can't know how someone else is feeling. It's not possible to know what another person is feeling. You can ask them, how are they feeling? Okay. And you can show empathy by saying, I think I understand how you must be feeling. But that's different from saying, I know how you're feeling. Okay. And that can be using that harsh tone of, I know how you feel, can be quite difficult. Okay, so do understand that and do share your own experiences, because I find that that can be quite useful. If I say to clients, I lost my own pet through cancer, and I talk about how I made the decision and how hard it was for me. So I say, I do understand what it's like to be an owner, but I can't know how they're feeling. I know how I felt when I was experiencing it, but I can't know how they're feeling right now. And that's often because of this issue, if you like, the background, the backstory. Okay. And we don't always know the backstory. So allow the owner time to express their emotions, let them be sad, let them cry, and let them know that you understand and you can see that they're upset. Okay, one of the worst things, the worst experiences of my life have been where I've been very upset. It's in a meeting maybe, and something's going very badly wrong and very, very stressed. And everyone's ignoring the fact that I'm really upset. Nobody's acknowledging it and nobody's saying anything. It's really important that somebody says, I can see you're really upset. Okay, so just remember that if we don't address the owner's emotions, it will be very difficult to get to the next stage. Okay, so the next stage is to say, right, how do we move forward? How do we take this forward? But it's really important for ourselves to protect ourselves because the owner's crisis is not our crisis. Okay. And it just cannot be. We cannot take on everybody's crises. And the picture at the top on the right here is a Samoyed that came to see me with a really nasty ulcerative soft tissue sarcoma on the point of the elbow. And the owner came to explore radiation therapy. And frankly, yes, we could probably irradiate it. It already had 2 failed surgeries and had recurred through that. And during the consultation, the owner said to me, she said, when this dog dies, I'm going to kill myself. And that comes as quite a shock when someone's basically threatening suicide. And there's 2 ways you could look at it. You could say, oh my God, I've got to keep this dog alive because otherwise I'll be responsible for her killing herself. Or we can say, hang on a minute, that's not my crisis. My job is to do the best that I can for the dog. And I said, oh, why is that? Why do you feel like that? And she said, because this dog belonged to my son and my son committed suicide, but he comes and visits me and tells me that I need to stay alive for his dog, that the dog needs her to look after it. And it would be very easy at that point to get sucked in to talk about, okay, I'll try and do this and I'll try and do that and I'll do my best. I did have to say to her that there is no way that the dog will die from this tumor. I can do what I can do, but I cannot cure this dog of this tumor. And that she needed to get some help. So what I did was I said, look, you need to get some support. What support are you getting? Because my job is to refer you on for support. My job is to not try and pretend that I can fix this dog for her because I can't. Okay, there's nothing more that I can do. And it's really important that we do have that boundary and we do have that ability to step away from people. Because I must admit, there's been very many clients over the years who have this link, some sort of link with someone who's passed away, or previous pets that have died and they felt guilty about it, and so they don't want to let them go. Okay, but the owner's crisis is not your crisis. You've got specific defined boundaries, and your job is to refer on if somebody needs that extra support. It's not your job to try and magically do something that can't happen. Okay, so it's really important to stay strong on that point. We need to provide a very clear plan for the future and having the treatment options. So knowing what is possible for the condition, what the options are, what the potential outcomes will be, will really help them to move forward. Okay, even if the only option is palliative care with euthanasia in a few weeks' time, being clear on why there are no other options and having a plan saying, okay, well, we're going to manage the pain, we're going to do this, will help them to move forward. And it's very rare that I'm in a situation where I'm seeing a patient and I'm insisting on euthanasia the same day. Obviously, that can happen when you've got extreme patients, but usually there is that opportunity for people to be able to go away and just have a bit of time. I always offer to talk to other members of the family. I know how frustrating that can be for all of us, when you've got 2 people who are separated and they both want to have the update on the pet, but they won't talk to each other. But I think in this situation, often just offering to talk, they don't necessarily take you up on it. But if there are key questions, it's better that they come back to you and ask directly, because sometimes someone will come home and say, oh, ask about this kind of treatment that I wanted to explore. So really important to give them that option to come back and keep the conversation open. Make a clear record of the conversation, the terms used, and the options discussed. So, I always write down, right, I've discussed surgery, radiation therapy, chemotherapy with these drugs, targeted therapy, palliative therapy, so that I know that I've talked all about all of those options. So if they come back and say, you didn't mention this treatment, which I found out about, I'm able to say, no, that's radiotherapy that you're talking about there. We talked about that, remember? And that's particularly important when you're changing vets, so it's clear that these have been discussed. Okay, so try and have a reasonable record of what you've talked about. So that brings me to my final slide, and it's just to really say that breaking bad news is not an optional skill. It is essential to our professional practice, but having a tactics and an approach that works for you is really important for our mental well-being. And I think, sometimes we have to remember in life that some of the skills that we need to be honed over time. So I've got a slide here. This is my daughter and her friend doing the crazy sport of equestrian vaulting. Anyone who's graduated from Glasgow will have been bored to tears by me showing you videos of this sort of stuff. And I use this slide for a range of reasons. Firstly, this is an optional skill. You don't all have to be able to do gymnastics on the back of the horse. You just need to be able to talk to clients and do a really good job with breaking the bad news. Okay. But also, whatever you put your mind to do, you can get better at. And I think that's something that I love about the VVS philosophy, is that I want, and we want, you guys to be the best vets that you can be. And we're here to try and make that happen. I've spent 18 years teaching students, and that was great. But now I can take those skills out into the real world and say, okay, how do I make sure that the best care is happening out there with you? And how do I support you guys to have the confidence to go out and do stuff that you didn't feel confident doing before? So I hope this slide and the picture shows you the confidence and the power that you can get from practicing and just getting better at things by doing them time and time again. So thank you very much for this evening, and I would now like to welcome any questions.
Thank you, Claire. That was a really brilliant presentation, and I think quite a lot resonated with me as well, especially that fear of steering away from maybe treatment recommendations because of the confidence and being able to deliver it yourself. I definitely have experienced that, and I think sometimes it's not even a conscious thing. It becomes, habitual, maybe because you just think, well, we can't do that here, or I don't feel confident, so maybe I'll just forget to you start forgetting to mention it, and then it definitely builds up. So I just wanted to say, if anyone has any question and answers, please add them to the box, but a huge thank you for that. And one question I had really, and would be for anyone that's maybe a senior vet or got vets in practice, I think this is a really important topic, especially for, like you mentioned, new graduates. Obviously we'll have this webinar recording for them, but do you have any recommendations for any other resources or things that they can look at or reach out to support them with these conversations? Because I think it's something that maybe isn't taught as much as it maybe needs to be, because it is so important.
Yeah, I mean, I think it's one of the real big challenges, because we all know when people are seeing practice, it's quite often these conversations that the student doesn't sit in on, isn't it?
Yeah,
they don't get to hear the conversations in the first place. So I suppose step one, I would say, is break that desire to separate out. Yes, it might feel a little bit awkward having somebody else in the room, but actually it doesn't. The owner's talking to that one person, and if you're handling it sympathetically, don't feel that you can't have a student in the room with you while you have these difficult conversations. So step one, try and have people in there so that they can experience a little bit more. There are lots of resources online about specifically looking at how you set it up, so the spikes protocol and things like that. But I think the key thing is get out there and practice it.
Yeah,
it's really difficult. I remember when I was in practice, I can't say I loved my year in practice hugely, but I became very good at euthanasias. And I remember doing a lot of very difficult, challenging euthanasias during that time. And every time I went out and talked to a client, I learned something new. Okay. So just talking to people and listening to people. And I think one of the things through the coaching, because I also do a bit of life coaching as well, and one of the things that's really come out through the life coaching for the people I've coached is let clients talk. You know, as vet students, you're taught, and I taught people this, you know, here's a list of questions that you need to ask about a dog with diarrhea or whatever. Let clients talk, because actually if you say, okay, what's the problem, and let them talk and explain what's been going on, they'll answer 50% of your questions at least. And then you just add in a few more questions. So I think listen to your owners, okay, and just relax. Just relax, you know, be yourself, because you do care. All of you are there because you care. And if you let that care come through, you'll get a better relationship with the client in the first place. It's really tough. You guys are out there front line, busy, okay, but often just taking a moment to pause and say, right, let someone talk, let them talk. Yeah, we want to kind of rush them and get them out the door as quickly as possible, but actually when they say it in their own words, you know, I think Fluffy's reached the end of his life, he's off his back legs, blah 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 blah, he's got cancer. We know what they're saying, you know. We've just got to listen to it instead of sort of going, okay, so tell me more about that, right? You know, how long has this been going on for? We need to trust that instinct. So trust yourself. So there are resources out there, but I think it is something that's so much about practicing. And I think having taught OSCEs and all of this for practice, I'm not sure how great it is, because it's such a false scenario. You know, you get given a little scenario, client's got, you know, metastatic disease in its lungs, you've got to break the bad news, off you go, you know. That's not how it works in real life. Yeah, it's not how it works in real life. And just, you know, be kind to yourself, okay? Be really kind to yourself, because if you're kind to yourself about, yeah, that didn't go as great, but don't worry about it, because the client probably didn't even notice that it didn't go that great. Okay, so be kind to yourself, and then you're going to be kind to them, and the relationship will blossom.
Yeah, and sometimes, you know, you feel that you need to have a facade and be the professional, but actually sometimes a bit of vulnerability can really help to build that bond.
Definitely.
We haven't got it was a few questions, but some comments, you know, people agreeing that the link of you know, a pet to you know, relatives they've lost, or it really opens up the old wounds and does make that conversation difficult. And Ruth agreeing to let students in to those difficult conversations. And I think that's such a brilliant suggestion, because yes, naturally you would say, oh no, this is going to be a hard conversation, please don't come in. But actually they need to see that, and actually probably the person that's realizing that that's a good conversation has that emotional intelligence to deliver it in a great way and be a really good example to the students. And lots of people thank you for your talk, and also really liking that I think I understand rather than I know how you feel. And going to be adopting that, so that's brilliant. So thank you, Claire.
Great.
One question: how do you handle one of the situations where the owners want to take the patient home for a few days to say goodbye, but you're fearful they won't come back for put to sleep?
Now, I've been here many times, and that's the challenge. I think, again, at the end of the day, it's something that as vets we feel really guilty about. Okay, we feel guilty if we send a patient home and it shouldn't be at home. Okay, and I've been stung by this. So I had one particular owner, and it happened 3 times, not directly to me, but it happened 3 times, where the first time she said she was taking her dog home for a few days and she never brought it back, and we were phoning her and asking, you know, what's going on, and it turned out it had died, and eventually, and we were like, that was a real failing. So when her next cat came in, it was coming in and it had a really bad bladder tumor and it was obstructed, and we drained urine from its bladder, and we said, look, there's nothing more that we can do. And she absolutely wanted to take it home. And I literally, unfortunately, in that situation, because I'd had that really bad experience from her specifically, I actually locked her in the consult room with me. And I just said to her, I'm really sorry, but you're not leaving until we both agree that this is what needs to happen. And I spent a lot of time talking to her, and eventually she agreed to let it go. It took a long time to explain and explain again, and there's nothing more we can do, and no, I can't keep draining the bladder, and go through all her questions, and it took a long time, which was not ideal. She then had a third cat. So you think by now we'd maybe have learned a lesson. And this cat was in ICU, and again she wanted to take it home, and we said no. It was very, it was on oxygen, it was horrendous, and we wanted to put it to sleep, and she was like, no, 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 absolutely not. And she said, you're probably going to overdose it, against my will. I wanted to die naturally. And I was like, no, we're not going to overdose it, but we are going to give it pain relief. And I was working at Glasgow, so I spoke to the anaesthetist, and they said, look, you can give this. This is the least likely to kill the cat. So we gave it that, and the cat died. Okay, which was not necessarily exactly what we wanted. We wanted the cat to be put to sleep with her consent.
Yeah.
So I think, to my mind, it's about judging the client, okay, and also talking about euthanasia. I think I hadn't appreciated until that article came out how resistant people are to talking about euthanasia, because I always try and bring it up in my conversations. I'm an oncologist, that's where most of my patients end up, but I try and bring it up. And the number of people who have very poor understanding about what's involved, just simple things like placing a catheter means that you can hold your animal on your lap and stroke it, as opposed to the old-fashioned way of off the needle, where there was a lot of restraint. That's what a lot of people have seen. So really talk to them about the process and the stage and how you can support them. There's lots of really good quality of life questionnaires out there that help people understand that there's a deterioration going on. And I also think by doing some end of life planning in terms of how you want the euthanasia to be, do you want ashes back, and I tell people to write it in a little notebook and have it in the house somewhere, so that when the critical moment comes, they can remember what it was they wanted to have at the end, instead of having a big panic about it. So it's never easy, because if you genuinely think they're not going to come back, then you probably shouldn't let them go in the first place. But what I would hope is that you can counsel them so that they can feel comfortable asking you and feel supported, and that you want what they want, which is their pet to be as comfortable and as happy as they can. So the quality of life conversations everyone's happy to have, and owners say they want the quality of life conversations. They say they don't want to bring up euthanasia, but I think there's a backstory here, because the number of people I've seen where they say, but my vet, if I tell my vet I want my dog put to sleep because of its cancer, they'll think I'm a bad owner. So you've got to be careful there, because actually sometimes by trying to do everything, we're forgetting that makes them think that they can't ask for euthanasia. So there's not a straightforward answer to that question, because it's so specific, but there's lots of different ways you can try and just learn. Sometimes the patient goes away and you don't hear any more about it, and you feel bad. There's been a lot of chat in some of the Facebook groups about this, where people are like, oh, and then the pets are in a right state when the mobile euthanasia service comes along, and isn't that terrible? And I haven't got the time to phone them. Yes, okay, if you haven't got the time to phone them, that's fine. It's not actually your responsibility, because they haven't come back to you, but try and make sure they feel comfortable coming back to you. So that's our responsibility, is to make sure they feel comfortable. We can't make them, but we can make them feel comfortable.
You want that relationship when they leave the door, so they'll still come back, that door is open. And
exactly.
I think what another thing you were saying towards the end, you were talking about really listening, and I think clients sometimes are ready for put to sleep or euthanasia, should use that term, that's but they're kind of tiptoeing around the subject, and they actually want you to bring it up as the vet in that consult room. And actually, if you then start talking about the next treatment option and things, they feel like maybe that's where that judgment of the vet is, and actually is it more a case of you're not listening properly to what they're trying to say. And I think that listening is so important, and it is difficult when you've got a 10-15 minute consult, and you've looked it up before, and you've got the next plan, and you know what direction you're going, but I think it's just a little reminder to listen to those clients.
Definitely. I think that is a danger, you know, if you go in, especially if you know you've got like a difficult client or a difficult case, and you've done your reading and you've done your research, and you're like, you've got what you want to say, and you've got a short period of time to say it. So it's like, that's what we're doing. And the owners are like, okay, you know,
Yeah.
but actually that wasn't, they came in to maybe discuss end of life management, or, you know, would it be bad to put the dog to sleep because they're going on holiday at the weekend, and, you know, they're going to be away for 3 weeks and the granny's looking after the dog, and they don't want the granny to have to make that call, you know, and that's reasonable in my view to do that.
Complete. I mean, this, and I think everyone has their, you know, for their pet, their limit of what they would put their pet through, don't they? And that's,
Absolutely.
and even within, you know, veterinary practice, everyone has a different limit of what's acceptable, and we need to learn to how to communicate that.
Yeah.
I think that's all of the questions. And thank you to everyone's comments. I hope you found that valuable. Like I said, there will be a recording on our YouTube and we'll share it on our social media. I think it's a really important topic to pinpoint people to. So if you do have any new graduates or any colleagues that you think would, you know, find this conversation valuable, please do point them in this direction. Thank you, Claire. That was
Thank
just
you.
a really wonderful conversation. It's definitely made me think about my communication skills with clients and all those factors that actually, when you take a step back, really make sense and can make that experience for the client and the pet so much better. So thank you, and hope everyone has a lovely evening. Thank you for joining us. And if we can be of any help at Virtual Veterinary Specialist with your oncology cases, please do get in touch. So thank you all, and we will hopefully work with you soon.
Bye-bye. Thanks everyone.